have planned. We started off on September 7th with a session by Dr. Lloyd. Today is really a very important day. September 17th is National Suicide Awareness Day. Our community has experienced this loss very recently, and it has been something that has been very close to our hearts. Nationally, this is a problem. These are some statistics. We see this dynamic change in statistics. And at the same time, this month really wants to highlight that we have resources available. We have resources available at every level within our own organization. With the help of the leadership, we will be having a psychologist available 50% of the time on site. Her name is Jessie Kelly, and she will be starting on October the 5th, will be her first day here. And you will be hearing from our leadership to be able to sort of involve her in the various activities and any other needs that you or your department may have. So as we have experienced this loss ourselves, let's just take a step back and think about the different feelings that we have felt. I personally have felt these, and also in communication with and conversations with others, these feelings have been echoed. Feelings of sadness, fear, anger, powerlessness, exhaustion, frustration, and fatigue. Each of us have had different feelings. I would like to submit to you that what we are really feeling is grief. Because grief is a normal and rational response to losing someone or something that's close to us. And indeed, we have felt that because we have lost that. As we unpack this grief, we want to fix it because we are in the healing vocation. We want to be fixers. Today, I'm going to ask and request you to really step back and try not to fix it, but to reframe your thinking. Let's each of us reframe our thinking and change our mindset. Because when we do that, that's what gives us hope, and that hope helps us to cope. Just as we are having to don our PPE each day with this COVID pandemic, that is our physical protection equipment, let's not forget that our psychological protective equipment, the other PPE, is just as vital, if not more. To help us do that today, I'd like to introduce Dr. Chris Cunningham. Dr. Cunningham really is a very well recognized expert, not just locally, regionally, but also nationally and internationally. Dr. Cunningham is the UC Foundation Professor and Industrial Organization Psychology Graduate Program Director in the Department of Psychology at the University of Tennessee, Chattanooga. He also holds an adjunct assistant professor position for research and evaluation at the University of Tennessee College of Medicine, Chattanooga. He's the Chief Science Officer for Logi Service, which is a provider of science-based talent management technologies. He teaches graduate level seminars for organizational and occupational health psychology, consulting skills and ethics, and organizational development design, and undergraduate courses for psychological research methods, statistics, assessment development, and professional ethics and career planning. His current research addresses multiple occupational health psychology topics, including stress and recovery processes and practices, the influence of individual differences and environmental factors on cognitions and behaviors, and topics related to managing multiple work and non-work roles. He is the 2020-2022 president for the Society for Occupational Health Psychology. On a personal level, Chris has been an outstanding collaborator, colleague, mentor, and friend. And with his assistance, we've really been able to develop and do some incredible work here on our campus. And he's also helping us with the LifeBridge program as we move forward with getting some outcomes data. So with that, Chris, welcome, and thank you so much for accepting our invitation.
I appreciate that introduction, Mukta. It's really a pleasure to be with you all this morning. As Mukta said, I've got my hand in a variety of activities and places right now, but I do want to stress that the topic I'm going to explore with you this morning is one that I've been very intrigued with and I've been studying for close to 25 years now. I've been fascinated for quite some time about the ways in which our groups and our social settings and our teams affect us. So I'm going to go ahead and throw these few slides I have here up on the screen to give us some structure. Just real quickly, I need to stress that this is not meant to be another presentation about stress. I mean, that's something I talk about a lot, and but the challenge that we deal with here is more than that. This is a challenge of awareness. It's a challenge of support, and it's a challenge of being able and willing to be a little bit vulnerable at times. So you're going to hear some of these themes kind of creep into the discussion this morning. And I'm going to do my best to plow through quite a bit of information for you all. But I do believe there will be some time at the end for questions as well. And so you're welcome to put those questions in a chat box if you'd like, or you can kind of hang on to them, and then we'll open this up for some discussion once we get to the end. Before we get too deep into this, I do just have to highlight a couple of important details. Number one, I am not a therapist, nor am I a licensed clinician. My specialization is in understanding and addressing how groups and organizations function. And that's the lens that I'm going to be presenting to you all about and through today. Just want you to understand that. And it's not because I don't care about these things, and it's not because I don't have training in some of these topics, but it's that I've chosen to specialize in the areas that I do specialize in. That said, I do have to stress for you as a psychologist that if you or someone you know is struggling with any of the challenges that might be highlighted in the presentation today, there's really no substitute for getting the care of a licensed or credentialed mental health professional. And it's so exciting to hear that you'll be having a resource like that on staff available to you all. I think most of the folks on the call today already know that we have a number of good local resources available. I believe that many of these were made available to you in a more detailed resource packet, which is a fantastic thing to have on hand. But I also think that in a time of crisis, if you're not sure where to turn, I think the LifeBridge resource is really one of the best places to reach out to. So just want to make sure these points are clear up front. By the time we're done this morning, I believe, if you're able to follow along with me, okay, and if I don't twist and turn your mind around too much, that you should be able to do the following. And so I do think it's necessary to stress these learning objectives up front, just so you have some sort of scaffold to listen around as I go through the points that I need to make. I really would like everybody to have a better appreciation of what psychological health is. I also would really like everyone to appreciate that this is more than mental health. So that's something we're going to talk about. I also think that the important, powerful, and influential role of social support is undervalued and underappreciated. So that's something that we're going to be discussing this morning. And then I really need to get across to this group that protecting psychological health can't be the responsibility of any one person or even any one profession of people. And I'll explain what I mean by that as we get a little bit deeper in this morning. If you retain nothing else from what I am able to cover this morning, I think these would be the 4 points I'd like to stress. One is that psychological health is greater than mental health. And I don't mean that in some sort of value-laden way, just simply that when you actually sit back and you reflect on what psychological health means, there's a whole lot more to it than just the mental aspect, okay? And I'll explain this more in just a couple minutes. The second point I want to stress and really drive home is that psychological health, the protection and the promotion of it is a shared collective responsibility. It's just to be really clear, it's impossible to achieve optimal psychological health all by ourselves. It's not a personal challenge, not a personal responsibility. And if we think we can control it by ourselves, then we're kind of lying to ourselves and we're setting ourselves up for some pretty serious failure. So that's something we need to be cognizant of. The third key point is that we've got to do a better job of designing support into the way we do work and into the way that our work systems are structured. And that's an organizational imperative, but it's also a cultural imperative within organizations and groups. And if the institution isn't able to provide the level of support that you need, sometimes we have the ability to build support from the grassroots level up. And that's something else we'll talk about here as well. And the fourth point I'll get into a little bit further on is that there is an incredible amount of work being done in the intervention space right now when it comes to social support focused interventions. And I really want to get across that these interventions can work when they're designed well. And when they work quite well. And I've got a whole series of these I want to just briefly summarize for you, not to create a laundry list of references or anything like that, but my real goal is to try to explain to you why these work. I think sometimes, again, people don't appreciate the power of simple social support. And I think sometimes the reason that we don't appreciate it is that it sounds too easy. And there's nothing easy about it at all. When it's done well, it's actually an incredibly effective way of reaching this particular topic specifically. So to get into the content a little bit, just to explore this area of psychological health more directly, I don't think anybody who's listening today would want to argue with me about this. You're here, so clearly this is a topic that's on your minds. But psychological health really is essential to healthcare provision, and it doesn't matter if you're a physician or a nurse or an administrator or a support staff member. One of the current projects that Mukta and I have been deeply involved in for almost a year now is a study of meaning and motivation and purpose in work, and how this is evident particularly in individuals who demonstrate resilience. Well, one thing that's becoming apparent already in the data that we've been able to gather is that one of the things that sets these particular individuals apart is that they've been able to figure out strategies for protecting their psychological health. And as a result, they're able to transfer their efforts, their energies, their focus, their care to the work that they do, whatever that work is, from the support staff levels all the way on up through the administrator levels. So when we talk about being essential, it's essential to the work that folks like yourselves do. It's also essential to your ability to stay resilient when times are tough. When I keep stressing that psychological health is more than mental health, what I'm trying to get at here is that when we talk about human psychology, we're not just talking about what's going on in our minds, not just the mental arena. Psychology is the science and the study of how we feel and how we think and how we behave. So a lot of times I try to think about the ABCs here because it's an easy way to remember: the affective, the behavioral, and the cognitive elements. And I think it's really important to just look at this for a second and think about this. When we start to think about our psychological health as something that touches on the way that we feel in a moment, but also the way that we characteristically feel over time, now that expands the picture a little bit. When we think about psychological health as something that affects how we react in certain situations and how we behave around others, our loved ones, but also our patients, our coworkers, well, now that expands the picture a little bit. And when we also realize that psychological health can actually change the way we perceive, appraise, and choose to process information that's being thrown at us every day, again, this enlarges the picture. So I just want to position for you that if we really want to be holistic and comprehensive in addressing these issues, we have to challenge ourselves to get past the mental health label. And I just want to stress, this is not just me talking. This is actually the stance of the American Psychological Association as well, which is the world's largest body of psychologists that are targeting issues of this nature. It's also a theme that we're seeing echoed through many of our professional associations in Europe. So just keep that in mind, that you're going to be seeing a shifting in this emphasis. And it's not just a semantics game. It's also really a purposeful shifting to help us understand the breadth and the impact of these particular topics. And I want to just also stress that this challenge that we face currently, managing psychological health, is not really a new challenge. In fact, this is something I'll come back to in a few minutes, but COVID has been a very difficult time in so many levels, but we could have been having this conversation, without COVID. The issue of psychological health has been around for far too long, and it's not fixing itself. Okay. What I do want to stress is that just setting aside any of the really current issues that face this world, we know already from close to 75 years of research on these topics that some of the most particularly damaging occupational factors for psychological health are the exposure to chronic social stress and insecurity. And when I talk about social stress here, think about any kind of mistreatment or slighting or incivility or harassment or bullying that you can imagine. Anytime that's present, that's incredibly damaging to people, especially in a work environment where we're supposed to be secure, where there's supposed to be psychological safety. And then add on top of that insecurity surrounding, connected to ideas of, not just am I able to hold this job, but am I able to make enough money to make ends meet? Do I have the benefits and the insurance that I need to cover my needs? And unfortunately, more recently, have I been classified as essential or non-essential? It's one of the most damaging labels that we've thrown around in recent times. And it's really striking how much harm that's done in addition to maybe some of the good that it did by shining a spotlight on certain positions. I do want to stress that these particular chronic stress experiences, they only get worse, like way worse, when there's an absence of social support around us in an organizational environment. And so to put this simply, it's bad enough to struggle the slings and arrows of mistreatment and insecurity. It's even worse when you have to do it by yourself. Okay, so if this concept's not clicking, hopefully that simple restatement will make it stick. And then, of course, I can't just not talk about COVID. I mean, it obviously does add a layer to everything we're doing, but it's interesting when it comes to psychological health, the layer it adds is a little bit different than what the popular media would have us believe. And what I mean by that, and I just go ahead and skip here to this next slide as a graphic for a minute. What I mean by what I was saying is that the effects of COVID on psychological health are not actually really that new. The way it's affected our psychological health is remarkably consistent. The thing is, it's just really exacerbated everything. And I'm going to share with you here over the next few slides some recent data that goes beyond some of the data that Mukta also shared. And what we're seeing is that the thing that COVID's created is an extremely long-lasting round of high-level exposure to anxiety, to insecurity, to ambiguity, to demands, new demands. I'm not just talking about having to wear extra PPE and having to work maybe even more crazy shifts or things like this. It's this constant weight hanging over people, and simultaneously to that weight, it's also interrupted and in some cases destroyed some of the more positive and healthy social connections and relationships that so many of us had worked very hard to put in place. What I find even more disturbing is that the longer this persists, the more many people are starting to think, maybe it's not worth, reconnecting with so-and-so, or it took a lot of effort. I'm kind of comfortable in my isolated life now. Or worse, I'm in such a bad place. These people aren't even going to know who I am. When I get a chance to reconnect with them, I'm not the same person that I was. So I don't want to damage their life by reaching out to them and trying to reconnect. When I hear people talk about stuff like that, it makes me, break down and cry a little bit inside, because it's a really awful, lingering, long-term effect of this pandemic that we can't treat with medicine. Okay, we're really not. It's going to have to be, we're going to treat it with a rebuilding of social connectedness. Now, that's not really what this slide's meant to illustrate. When we look at this slide for a second, understand that in all occupations, doesn't matter if we're talking about medicine or healthcare, I could be talking about food service working. In all occupations, there's a constant balancing of demand exposures and the available resources we have to meet those demands. This is the simplest way I know how to help people appreciate the complexity of work-related or occupational stress. The simple truth is that work means that we're going to confront demands, and that's okay. And honestly, confronting demands by itself is not inherently bad. What makes it difficult for us psychologically and physiologically is that when those demands are coming at us at such a pace and at such a volume, and we don't have the corresponding resources that we need to address those demands, that's when things get really off kilter. And in this particular diagram, you may notice that, yes, it's tilted more on the demand side, and that's on purpose, because unfortunately, when we're at work, more often than not, there's a chronic imbalance between the level of demands and the available resources that are there to meet the demands. Now, not reflected in this diagram, but something I just want to overlay on top of it is that where we see this imbalance most pronounced often is in the realm of psychological and social demands, the psychosocial demands and resources. In really straightforward terms, we expect far more from workers when it comes to the psychological and social demands than we provide in terms of corresponding resources. And what I mean by that is, like in a medical environment in particular, we have no issue usually providing, physical PPE. We have no issue making sure that you have access to technology, to the medicines, to the supplies you need to do the physical things that you need to do when you're interacting with patients, when you're trying to take care of your records, and entering. Everybody loves electronic records, right? So like having the technology you need to do that kind of stuff, that is there. What tends to not be present is are the resources you need to keep up with the emotional toll of interacting with struggling patients and family members, with the fatigue that comes with the work, with any of those days when you just get to work and you just start questioning, what am I doing? Why am I doing this? Do I really care about this? Those are examples of the psychosocial demands where we just honestly, part of the problem is we haven't fully figured out what resources best match those demands. And this is where research is right now. So don't feel like this is something that your institution is just behind on. It's not, but this is like one of the big challenges right now, is figuring out what are the corresponding resources. And one of the points I just want to try to stress today in our talk is that really one of the big corresponding resources here is high quality, positive social support. Okay. And I know I used a phrase there that may not be very common, this idea of quality, positive social support. And some of you might be thinking, well, isn't all social support positive? And the answer to that question is very clearly no. Okay. In fact, there's some really fabulous research that's been coming out in the last 5 years or so about how some social support does more harm than good. Because in a nutshell, it ends up kind of hovering around the domain of micromanagement and people sticking their noses where they don't belong. Okay, that's not a scientific term, but that's basically what negative social support looks like. So there is a need here to help people realize, how do I provide support that is going to be constructive and provided at the right point in time. Now, as I'm trying to stress, the demands of any situation, if they exceed those resources, then we experience the stress. And again, as I said, today is not a presentation about stress per se. The issue, though, is that when that imbalance persists for an extended period of time, well, now that's where strain develops. That's where consequences develop. And when the imbalance is experienced, in particular in those psychological and social areas of work, well, now, unfortunately, those strains tend to hit us in the psychological and social areas of our being. So one thing that COVID has done is it's really stretched people in an arena where they've got far more and far newer demands than they've had and no resources to match it up. And unfortunately, what we're seeing is that certain populations of workers are particularly struggling. So these data come from a population survey that the American Psychological Association runs just about every year. It's called the Stress in America study. And what's interesting about this one is that they've been releasing data every couple of months, and they've actually been doing some pretty interesting analytics with it. One thing that they've found characteristically through the last 18 months is that essential workers, those classified as essential and those actually doing work that's essential, even if their label doesn't suggest it, they are struggling big time. One thing I want to stress here, given the topic of this talk, is that close to 75% are essentially asking for emotional support needs, emotional support resources, excuse me, and they're not able to find it, okay? And I just want to emphasize that this is not just a finding from this particular survey, okay? There are at least 3 or 4 other surveys that I've seen where a similar message is coming across. I also would like to stress for you the second statistic over on the right, 34% receive treatment from a mental health professional. Now, that may not seem like a big deal to you on first glimpse, but you need to keep in mind that in some areas of our country, that's about double the rate of mental health treatment seeking. And so the fact that individuals are out there at that level, at that magnitude, really is an indication that these challenges are very real, and it's becoming more and more normal and more necessary for folks to find that help. They popped out the data on this particular slice of the survey APA did a little further. And I don't want to spend a ton of time digging into this too much, but I do want to just stress that not only are we seeing higher rates of perceived need and willingness to seek out treatment, but notice that third statistic from the left, 24% were diagnosed with a mental health disorder since the pandemic started. Okay, now that is also a higher rate than what we would normally see. And I'm just trying to stress again that these changes specifically, you can also see manifested in other ways. So at the right, you'll see some of the more common symptoms that are tracked as indications of maybe some more serious underlying challenge. I would like to emphasize that although those symptoms are actually very common, so sleep impact, unwanted weight change, more drinking, more substance use, there are other factors that are also predictive. And toward the end of this talk, I'm going to share with you a study that was recently done involving a checklist for indicators of poor psychological health. And I really think there's merit, to leveraging tools like this as we try to improve the quality of our internal social support. Just a couple other data points here to help you appreciate how complex and far-reaching this situation has been. I want to emphasize that the effects of COVID have not been consistent across all demographic groups. What we see here in these data, one thing we see is the impact of a lot of different contributing factors. This particular one looks at age, racial-ethnic status, and SES, or household income. But setting aside that for a second, if you just look at these numbers, one of the bigger takeaways is that COVID has contributed to significant increases in psychological distress for the entire population. And we know that in certain occupations, the impact has been even higher. And that was some of the information that Muqta shared earlier. Here again, note that there are differences even if we try to split by male and female. But of course, I have to kind of acknowledge that this distinction between male and female reporting of symptomatology and sort of even negative affect less, seriously, this has been very commonly found between male and female individuals. Some of it has been boiled down to perceptual differences and emotional reactivity differences, but that's not the takeaway. The takeaway is that notice the ebb and flow. And really the reason I included this here in this presentation is to have you pay attention to when we see some of these peaks. Okay, so this is data that runs from April 2020 to August 2nd of this year. And where you see the peak is where we have individuals reporting the strongest symptoms of depressive disorder. And so one peak, okay, summer holidays. Second peak, winter holidays. Okay, unfortunately, in other words, these experiences are going to ebb and flow with the cycle of life. And that's another piece that work organizations especially love to ignore, is that, the idea is that, well, the work hasn't changed. The demands haven't changed. We're not asking anything new from you. What's the big deal? Like, why are you struggling now? That's just a really myopic and nearsighted way of thinking about the demand profile that workers experience. Again, to simply put it, the work we do is done in a broader context of life. And even if it doesn't feel like that way sometimes, what's happening in the world around us is affecting the way that we are able to approach and tackle the work that's in front of us. And so I just want to highlight this because, again, if organizationally we're trying to respond to these types of needs, then we need to be thinking beyond the realm of the immediate demand, the immediate challenges, the immediate work that's being done right here and now. We need to be thinking more broadly, what else is happening? And look, we saw this not just with respect to COVID. You might recall, go back about the summer of 2020, the racial justice and social justice unrest that was affecting the society suddenly became a topic that we discussed at work. That was actually one of the better moments where there was recognition that, hey, what's going on out here is affecting what's going on in here. But somehow we're not fully making that connection when it comes to these lingering psychosocial demands of COVID. So that's just something else that we need to be cognizant of. For many, way too many, this whole COVID situation has led to some very serious consequences, especially among the essential workers. And that's the second grouping you see here from the left. All the data, including this set here that I've just been blasting through, it tells a number of stories, but the biggest one I think it tells and most consistently tells is that many people are struggling with psychological health now and during COVID, and it doesn't make you special if you are too, okay? I just want to stress that. It also doesn't mean that there's something super wrong or different about you or any of your friends who may be struggling with this particular type of challenge. The truth of the matter is psychological distress is widespread. Now, the other sad truth of the matter is that our network, our methods of helping people cope with and manage through these difficult times, well, unfortunately, that has not dramatically improved. So we've got a lot more need and not a lot more supply. And this is where, we get away from the data for a minute and we just need to explore a couple of important things. When it comes to psychological health, what I find really disappointing, and I would call it crazy if that wasn't such a value-laden term here, but I have to throw it out there because we continue not to talk about psychological health. It's too personal, it's too serious, too complex. I'm not qualified. Oh, that's a very personal problem for you. It's not my business to stick my nose in your affairs. And like, I think often that reaction comes from a good place. It comes from a desire to, again, not provide that kind of negative social support I mentioned earlier. Like, we don't want to become a busybody. We don't want to get in people's business. But a lot of times that's not the only place it comes from. A lot of times that mentality, that approach comes from our unwillingness to open up and allow somebody else to be vulnerable with us. In other words, the threat of somebody else being vulnerable makes us uncomfortable. And that shines a light on our unwillingness and inability to be vulnerable and to be empathic and to be the emotional beings that we are. We have to start by just acknowledging that psychological health exists on a big fat spectrum, okay? It goes from really bad to really good. And just because you might need to challenge yourselves, and we all do really, to open up to watching and caring and protecting each other's psychological health, it doesn't mean that all the time we're just going to be dealing with crises, okay? Sometimes, and this is one of the beautiful things about caring about psychological health, is sometimes when we listen to others and what they're dealing with, it's actually remarkably uplifting, okay? It's remarkably inspiring. And again, I know this really well because we just completed this 9-month study of how people are managing all of this right now. And I could walk away feeling incredibly depressed and worried for some of these folks, given everything they've been dealing with, but that's not where I'm at. Where I'm at right now is remarkably inspired by the stories that people have shared and by the way that they've processed these challenges and by the way that they're supporting others. And so this is something I just really want to try to emphasize and get across is psychological health is too important to ignore. Okay, we need to get over ourselves, really, and we need to be willing and able to be a little bit vulnerable and a little more human and really get into the habit of watching over each other. The way we get around these challenges of psychological health is with being there, okay? Being there, showing up and watching over each other. And I just want to, as a sidelight, I'm not going to go far down this tangent, I promise, but I just want to stress this challenge does not just apply to healthcare. Okay, we're seeing a huge push and emphasis in addressing this challenge in law enforcement and in the first responder community. And there's a ton of effort being directed at the military for these types of issues. There are folks now bringing these challenges and issues into the legal arena, trying to help lawyers and their staffs kind of cope with these challenges better. So again, these are more global and systemic needs, okay? But the specific challenge that I know that we're attuned to right now is in the healthcare space. Here's one of the points I also have to stress. Again, like I guess we'll thank Reading Rainbow and LeVar Burton for this one, but you don't have to take my word for it. Okay, the gap here is incredibly real. These data again come from APA, and they have a Center for Workforce Demographics and Study, and these are the projected gaps between now and 2030 for those who are going to pursue a level of training that would allow them to become licensed mental health professionals, psychological health professionals, and those currently on track to do so. And again, we don't really have to do the math. You can see there's a massive gap between the red and the blue bar. And the answer, I'm not convinced though, is to just throw more people into this pipeline, because here's the really sad thing. Looking at this graphic for a minute, even in areas of our country where we have high saturation of trained and licensed clinicians, the utilization rates aren't all that fabulous. Okay, so like I just want to stress, like you might look at some of the shading and say, well, wait a minute, like there's some good color here in New York and Massachusetts, and over here it also looks pretty good, until you look at the scale and you realize that the dark red is 22%. Okay, so what we're seeing is that even when we can provide high levels of trained professionals, the folks who may need it aren't getting there. And then in some cases, we have a lot of trained professionals, like take New York State, and especially concentration in New York City. And you see that statewide, the utilization is very low. In the city, the utilization is like, on par with some of these other places, about 20%. And again, we might say, okay, well, 20% is not bad, right? I mean, like isn't that really all the need that there is? And it's not. I just showed you that. Okay, it's like it's really 25, 30 for some of these conditions, 40% is where the need is. So we have this massive gap. And the point I'm trying to get across here is that we can try to think and act like the answer, the cure, or the fix for psychological health is through the licensed trained professional. And again, I'm never going to undercut that, because in the serious conditions, that's absolutely where you need to go. But on a day-to-day basis, if that's the mentality we have, then all we're really doing is kicking the can down the road. We're just saying, look, that's not my job. I was never really a clinician. I'm not clinician material. Okay, but are you friend material? Are you a colleague material? Are you a caring human being material? Because if so, then we need to start looking at other answers. Okay, so here's my main point, and I'm sorry it took so long to get here. But really, protecting and promoting positive psychological health at work is a work and organizational design challenge. And really what it comes down to is building climates, and that can be loosely defined as practices, so policies, procedures, practices that encourage positive interaction among employees, and that help to ensure that when we're at work, we experience high degrees of what's known as psychological safety and inclusion. And I'm not using that word inclusion to stress diversity. That I know that word is often being used synonymously right now, but I'm talking about inclusion as in, like, I have a place, I belong here. People care about me. And if something changes in me, or the way I act, or the way I behave, the way I talk, the way I dress, somebody's going to know. Psychological safety, again, is focused on counteracting that social stressor category that I shared earlier. Remember that content about mistreatment? When we have workplaces characterized by mistreatment, common mistreatment, and frequent mistreatment, those are not psychologically safe environments. We should be able to go to work feeling that this is the safest environment in my life, because this is a place where we know how to perform our duties and treat each other with respect and watch out for each other. And one thing that we do also often forget, everybody, is that we tend to act like, oh, well, work is where the demands are, but home is where we go to relax. And I can't believe that I need to be the one to break this to you all, but there's a whole lot of people out there with home realities that are a disaster. And it's not necessarily through any fault of their own, but for many, many people, work is the controlled environment. Work is the domain where things make sense. It's where the ambiguity is lessened. It's where there's structure. It's where there's rules. It's where there's protocol. And it's where there needs to be a safety net. Okay, that's the thing that's missing from many of our organizational environments. And again, these are not just my concepts. And in fact, if you're intrigued by any of the themes that I'm emphasizing, there's a gentleman I respect very much. His name is Paul Spector. He's an emeritus professor at the University of South Florida, been studying occupational stress far longer than I even knew the field existed. He's now gotten into blogging because he's realized that his articles weren't reaching the audience they needed to. And so he's also a fabulous writer. And so pretty much every week he's putting out something on occupational health in an incredibly accessible way. And he recently just tackled the topic of how employment can contribute to suicide prevention. And so these are some of the themes actually that he decided to highlight. I actually spoke with Paul 2 nights ago, let him know that this presentation was happening, and he was ecstatic to know that this group, all of you, cared enough to want to listen to a presentation on this particular topic. So I just wanted to pass that along. So let's dig in here a little bit to the specific topic of social support interventions. We know in recent years, and by recent, I mean like within the last 10, that social support interventions can work. And they don't just work in specific groups, they work in diverse populations, including soldiers in combat, educational administrators, healthcare professionals. The reason they work is that they are well informed by psychosocial theory and evidence. They also work because they're simple. And this is the problem with so many other interventions, is they get way complicated. They require significant amounts of time, lots of money, lots of resources. And in this particular population, that's a non-starter. I know that even many of you finding time to join me for this talk was a big deal, okay? So we need to be honest with that. The other reason these interventions work is that from an exposure kind of mentality, when you create a social support intervention, you create a very robust exposure and delivery mechanism. In other words, if I create the norm that we're all going to support each other, then that means we're all going to support each other. So we're wrapped in that net. We're wrapped in that intervention. We can't get away from it. And the wonderful thing is that when these interventions take hold, what ends up happening is the social norms in that group or that organization change. And they change to facilitate and encourage positive social support, awareness of risk factors and symptoms, and a shared responsibility, looking out for each other. The other thing, the other consequence of these interventions generally is that they raise this general feeling of collective vulnerability. Again, to try to translate this into simpler terms, we're not all okay, and that's okay. And this is something that is a hard lesson for a lot of folks to learn, especially in healthcare. The concept of not being okay is not something that we generally feel good about, and that that's understandable. But again, in a social network and a social support intervention, that's one of the things that we come to grips with. And then the other big impact here is when we have social support, well, what we don't tend to have is social mistreatment. Those two things can't coexist. So that's the other reason these interventions work, is that we're creating this improved culture, really, is what it comes down to. And I want to just talk briefly about this image, because I'm not a big fan of throwing pictures into things without meaning. So I really think this is an important image to not lose sight of. Some people talk about social support as a safety net. And so, okay, that's what the sides of this swing bridge are. But in my mind, that's not enough. When we're dealing with crises, especially of a psychological nature, just a safety net's not going to get us to the other side, okay? What we need is a path. And that's the cool thing about this image. And if you think about any place you may have hiked around here, you've probably been across one of these bridges before. And sometimes they're darn scary. Like sometimes they're just a 2x4, just that you have to kind of carefully walk. The thing I always find interesting is that most folks, when they go on hikes that take you to places like this, they don't always go by themselves. And they're actually feeling a lot better when they're not by themselves. And you think how it typically works. There's somebody that goes across to the other side and they're pulling you across. And then there might even be somebody behind you saying, hey, are you going to get going? I mean, like, we want to get across this bridge. And so when we have a push and a pull and a safety net and a path, what happens? We make it. But if we don't have those elements, well, we don't. Sometimes we turn around. Sometimes we just stop. And that's really what a good social support intervention does, is it gives us the push, the pull, and the safety net, okay? So I know it's getting tight on time. So real quick, I do want to just share this information with you. And if anybody's curious, I will be happy to share slides. But three main buckets now, okay, of social support interventions. One, battle mind debriefing and training is one of the most well-established interventions out there. It is very similar in structure to some other trainings you might have heard of called Battle Buddies or Peer RX. These are newer and they don't have the evidence base behind them yet, but they are structured almost identically to what the Battle Buddies, to what the Battle Mind debriefing does. And what they found is it's not necessary to relive the traumatic event. It's enough to recount it. It's enough to talk about it. It's enough to share experiences in a supportive group setting. And when they've used this, they've found improvements to unit morale and cohesion. They've found high levels of ratings of this being relevant by the mental health providers that are embedded with these units and supporting these units. And these studies that are in the top bullet point, these were done during combat in Iraq. We've also found that over time, having the presence of this battle mind in that unit has led to fewer PTSD symptoms, even among combat experiencing folks, lower levels of depression, reduced sleep problems, and that this is more than what's seen when just a stress education training is put in place. And that's the important piece here is what's the difference? Well, the battle mind debriefing is normalizing social support, and it's normalizing us asking for help. And a general stress training doesn't do that. A general stress or resilience or recovery training puts the onus on you as an individual to take care of yourself, to engage in self-care. What we're talking about here is not just self-care, we're talking about other care, okay? And that's a shift. It's not a big shift, but it's a little shift. And that's really what it seems to be explaining the impact. A second series of interventions that is gaining in popularity because of their simplicity and because the evidence comes from a non-combat population are the mental health awareness and coworker health awareness trainings, MHAT, CHAT. These are really well designed and developed. They are designed specifically to leverage leaders and coworkers as sources of support, early recognition, and referral. Again, pushing, pulling, and support net providing. And what they've demonstrated in a couple of some of the best studies I've seen in this arena is that they can significantly improve leaders, supervisors, managers, ability to understand psychological health, to be confident or self-efficacious in responding to this. They have a more positive attitude about caring, regarding employees' psychological health, and then also have increased their intentions to do something to protect and promote psychological health. We've also found in more sort of objective data that when these interventions are deployed, there's a notable reduction in the number and the duration of mental health disability claims in the organizations where they've deployed these interventions. And I just want to stress the battle mind training, that's pretty serious stuff. Like that requires some heavy resources. This one takes 3 hours. And it's 3 hours with some follow-up material. I'm actually convinced it could be delivered even more succinctly. And it's something I had already shared with Mukta about something we may want to try at some point down the road. But what I really want to stress is they're showing these effects, not just in the moment, but up to 19 days, over 9 months rather was the stat I was looking for. 9 months post-training, they were still seeing these effects, which I think is fantastic. And related to that last one of the challenges with training coworkers and managers what to look for is basically what to look for. And what they've found is there are 5 warning signs that are fairly easy to observe and are predictive of distress. And right now, that includes evident distress, but also withdrawal behaviors, reduced attendance, degradations in performance, and extreme behaviors. And the definition of extreme behaviors is actually not as extreme as it may sound. It's simply a change in appearance, a change in reactivity, that kind of thing. And early evidence from 2 studies that they've done here indicates that this basic checklist, which takes seconds to complete, actually correlates very strongly with a person's self-rating of distress. So in other words, I can observe in you distress that you might not even be reporting, and this is picking it up. And we know there are other predictors as well that can be monitored. History and experiences with substance use and abuse, challenges with mental and psychological health in the past. These have also been shown to correlate and predict with these types of outcomes too. So again, these are 3 groupings of intervention strategies out there. You'll notice what they have in common is raising awareness, empowering people to do something about it, and then generally elevating the profile of us watching out for each other. So if we wanted to build on this just loosely, where could we go from here? I mean, one of the big takeaways is that none of us are islands, even if we think we are or would like to be from time to time. We have that shared responsibility. And I know you could say, well, isn't that just another demand? Yeah, it is. But not all demands are created equal. This is a demand that we want because when we respond to this demand, we create a resource. And that resource is a supportive network. Here's the thing, when we care for somebody else, they tend to care back. And so when we help somebody in their time of need, they're going to be there in our time of need. If we don't do that, we create a demand that just continues to get worse. It's a cyclical demand, and that's not really sustainable. Person to person, what this would look like is basically being there and aware of each other. If we do that, it protects us, it protects our occupations, it protects our families, it protects the people we serve, it protects our community. Organizationally, doing more to promote awareness, identifying and addressing risk factors that are known to connect with these types of challenges, and then continuing to provide resources. And I'm not putting these here because I think your institution's not doing this. In fact, I'm really proud of all the work that's happening in this community. I'm putting it here to underscore that what's being done is what needs to be done. And hopefully we can all collectively do more. Yeah, I'm going to stop there. I hope that there was something in that could resonate with you, gave you some things to think about. I know we're close on time. If anybody does have questions, I'm happy to stick around. But otherwise, you can also reach me at that email address there if you want to follow up separately from today. Appreciate the time.
Thank you, Dr. Cunningham. And I think you've given us some really important points to think about and really dovetails well into the planning of this month. Before we open up to questions, do you mind if I just share my screen a minute? Chris, if you want to stop sharing, please. I just wanted to remind people of a couple of events that we have, and then we'll open it up to question. questions. The first thing is that on September 20th, we will be joining the Tennessee Suicide Prevention Network for the axe throwing. The students are complimentary. You just have to let us know. So if there are any students or if there are any students that you are aware of, please let them know to sign up. For all the residents and fellows and faculty, it's $20 per person. And I just want to echo what Dr. Mandriata is doing, supporting his department. I hope other chairs and leaders will do that. And just as a reminder, it starts at, I think, 6 o'clock, not 8 o'clock. The second thing is the yoga in the park on September 25th. Please sign up for that. And then the walk that we will be having on October 3rd, which will be, again, partnering with the national organization. It would be to honor our own Dr. Walter Capote. Please go ahead and RSVP and register. Because the Medical Society and we will be providing T-shirts and we'd like to know how many. So just wanted to remind everybody about that. I think what you've heard Dr. Cunningham really challenge us to ask ourselves, are we friend material? Are we caring material? Can we provide social support for each other? And that takes us to this oath to self-care and well-being, which is really a commitment of a partnership for care of ourselves and our colleagues as we partner with our organizations to create a culture of well-being so that we can take care of our shared purpose, our shared covenant, and that is care for our patients and their families. So with that, we will be really reminding you of this, and I hope that you all are thinking about using this in your own departments, and we hope to pledge this at our next session with Dr. Barron on September 24th. And this is the code to the CME, so if you all want to go ahead and fill that out, I just wanted to share that. So I'm going to stop here and echo what Dr. Haynes put in the chat box, that as we think of building this social support and normalizing it, how can we buddy check with each other? We do that, some of us, on a Friday afternoon, but let's go ahead and pay that forward. And just the simple human value of being kind to each other, as Dr. Haynes mentioned. So I will put up that QR code again. I apologize. Sorry. Here you go. So with that, I'm going to open it up for questions again to Dr. Cunningham. Dr. Cunningham, thank you very much. And I really will keep that picture of the hike across the suspended bridge in mind as we think about what we do.
Sure. Yep.
Dr. Cunningham, I have a question. Thank you for a wonderful talk. You mentioned the MHAT, you mentioned the chat, and that it could be delivered in a succinct manner. Do we have those resources here? How do we go about actually putting it into practice?
Yeah, I appreciate that. And I believe at least one other person raised a similar question in the chat. We do have those resources here. I know the developers of the intervention. I've been in touch with them a little bit and believe they're close to sharing some of the contents with me. The approach that I was taking with them is I've been very impressed with the work they've done, but I think that we can fine tune it for healthcare. And I think that we can deliver it, as I said, more succinctly. I'm trying to persuade them to share the materials they use so that I could adapt what they did so that we build on top of it. But where I'm at right now is if they don't decide to go forward with it, I know enough about the intervention that I believe we could design our own version of it locally. So that's something that I was talking about with Mukta and others on the LifeBridge Task Force. So to go back to your question, we have the resources. They're probably not ready for prime time today, but it's something that I hope to be able to deliver to this group or to anybody who's interested sometime over the next few months.
Yeah, thank you, Dr. Sethi, for that question. And as Chris mentioned, with the help of a team, we are looking at really providing these training opportunities for people at different levels.
Mm-hmm. Are there other questions that we can tackle here in the few minutes we have left?
Good morning, everyone. Dr. Brewer here. Just wanted to make a comment and also thank Chris and Dr. Panda for her leadership in this space. I'm in the last third of my medical career, I will admit. And while I was listening to Chris and thinking about it, it reminds me of some of the machinations that we've gone through. I remember a time when we had to teach ourselves to put the family history in when we were doing histories and physicals. And I'm also reminded about the fact that we finally realized over time that there were people dying of colon cancer and breast cancer because we were, as a society, reticent to discuss them. And for me, the take-home message is awareness, really. And it begins with ourselves, but it also is included within the organization. And as a new, grateful physician leader within the Erlanger Health System and UT, et cetera, I'm very grateful to Chris and Dr. Panda and the rest of the team for bringing this to the forefront. And we'll continue to work on this. There's a lot of work going on now, and we will continue to build on that. So just want to say thank you so much.
Yeah, those are great observations, and you're absolutely right. One of the big points to emphasize here is awareness, but also trying not to be scared to reach out and provide support, even when some of these topics might seem like they fall outside your realm of professional knowledge and experience. All of us are capable of being human with each other. And even if we may not know exactly what to do when the going gets really serious, we do know enough to hold that person's hand and walk with them until they can get to the resources they need. I can share from my own experience as a professor. I used to also be involved in residence life. I'm not glad, but I'm happy that I've had the privilege of taking literally probably 40 students with me to our counseling center in times of crisis, physically walking with them across campus to that resource. And those are always very awkward moments, and it doesn't sound like it should be part of the job, but it really is. And it also didn't take more effort than I felt comfortable expending. Like, I knew that I wasn't the one to help walk them back, but I knew that I could get them to the help that they needed. And that's just something that we just need to challenge ourselves to do. I keep also seeing questions and wanting more information about these, and I appreciate that. As I said, I'm happy to share a copy of the slides. If you can give me a couple of days, I'll also put together a reference list for you all. I've got them all packaged up. I don't have time to format it today, but I'll be able to get that to you, and that'll give you access to some of the initial materials that are publicly available. If you're interested in implementing something like this and you want to talk about how to deliver it and evaluate it, that's a resource that I'm happy to help talk with you about too. I know we're at time, so I want to be cognizant of that. So I understand if you do have to jet, appreciate that. I'm happy to stick around if there are a couple other questions.
Yeah, Chris and Dr. Panda, if I might, 13 years ago, this is Dr. Haynes, by the way, one of the family docs here at Erlanger. 13 years ago, one of my colleagues, who I was a program director at the time, one of my colleagues who was the assistant PD, we had worked together as faculty prior in another residency. And she called my wife one day and said, "Hey, what's wrong with James?" And my wife, gently said, "Well, I was wondering when you guys are going to figure that out." And so I'm not sure exactly what would have happened if she hadn't made that call, but I was at a pretty down place. And it took a lot for me to go to one of my mentors, who I was actually their boss, the way the military civilian things work. So he was one of my faculty in residency. Now I was the program, and he was program director, and he was a civilian faculty. It took a lot for me to walk into his office, sit down, and go, "Bob, I think I need some help." So if Tricia Gudemote hadn't made that call, I'm not sure exactly what would have happened, but I'm very thankful for that. Those were some tough, dark days. But, the bottom line is all it took was one phone call and somebody reaching out. So I would encourage all of us to just look, see the people around us, truly, have some vision and see, and not be too self-consumed. Because if the people around me would have been self-consumed and said, "Oh, Haynes, he's tough, he's going to make it, he's our leader," I'm not sure exactly where I would be today. So thank you, Chris. Thank you, Dr. Panda, and everyone who attended today. And good on all of you for attending.
Powerful testimony. Thank you, James.
Thank you, Dr. Haynes. I think the courage to be vulnerable, and though our stories are unique, they have universal resonance. And let's just remember that the person next to us is our friend, our colleague. We may not know them very well, but let's look out for them. And with that, I just wanted to say thank you to all again for being here today. And as we move forward, thank you, Chris, for providing the resources. We have also got a resource list that we are putting together, and it'll be on the LifeBridge website with the Medical Society, thanks to Ray Bond. I want to thank Dr. Barron for being on the call also. Dr. Barron will be our speaker on the 24th. So thank you. And thank you, Dr. Brewer, for your support. Welcome to Chattanooga. And we appreciate you being here today. Thank you again, Chris. And everybody have a great day and be safe and be well and have a great weekend.